I'm Dr. Mark Brayman, and this is the Comprehensive Healthcare Pyramid Model. I think the best way to share this with you is simply to tell you the story as to how it came about. I was actually working in an integrative medicine clinic at the time, and one day I was sitting at my desk and thinking about how healthcare could be, should be, how to put the pieces together. And I took a blank piece of paper and just started writing any and every therapy I could think of on this piece of paper. And as I was looking at that, I started to realize, these are really similar, and these pieces are really similar, and these are similar. And so I started to put them into groups. They were just natural groups from the basic concepts. And then I started to look at that and think, if I was the patient, I would really want to do things from this category first and want to do these last, and so forth. And so I started to put this together in an order. And it actually got really clear pretty quickly. I was pretty excited, but I thought, maybe this is just me, this is my perspective, my brain. So I've tested this with many audiences over time, both public or lay public and professional, with minimal guidance, just an exercise in building or designing healthcare. And what's been fun is that we always basically get the same result. This is telling me we're getting to some universal truth, a model of care that we can all recognize as making the most sense and that we would all want. We always come up with the same categories, and people always put them in the same basic order. As we put these possible treatment options into natural categories, we ended up with 4 basic categories. One was treat the cause, deal with the lifestyle aspects that are producing the disease. The last one was obvious. The last resort would always be surgery, chemo, radiation, the dangerous, invasive kinds of things. And then we get to sort of all the natural therapies, if you will, what I've called physiology. We want good science, but these are things that are going to be beyond what a person would do in their day-to-day lifestyle, that they would do for themselves. It often involves another healthcare professional or person, sometimes doing something to you. And these are going to be things like physical therapy, taking an evidence-based nutritional supplement, behavioral health counseling. Those kinds of things all fall into this physiology category where we're trying to restore normal, healthy physiology without doing it through an artificial means, getting things back to a normal, healthy place or state. The prescription is pretty obvious. By definition, foreign, artificial, higher risk of side effects, problems. But when you need it, and it's good to have that option. We just want to use it in the right place. So we've always ended up with these same basic categories and in the same basic order, which is pretty cool. Now, I put things into a pyramid format. I just think it's graphically easy to understand, to make it visual. And when I first put together this pyramid, each level or layer was the same height. And that was fine. And what was fun is, as I would share this with patients, if they hadn't already seen it before they came in to see me, I would pull it out and show it to them. And they'd look at it for 3, 4, 5 seconds, then often their hand goes out and their finger points, that's what I want. That's what I'm looking for. But I can't find it anywhere out there. And part of what has been fun over time, or I've been very gratified to see, is such things as when we did the lifestyle medicine competencies published in JAMA. That lifestyle is considered foundational, which is what is in the pyramid, and what we had come to from another process. It's also been fun to have this confirmed. There was a period of time where I was participating in a group getting integrative medicine training into preventive medicine residencies on a national sort of level, and was interacting with these other top integrative medicine experts. And we had these side discussions about this model, this pyramid. And they got excited. They said, yeah, basically this is more or less the model that we have too, at least in terms of the therapeutic order. So that was nice and confirmatory. Now over time, I got to looking at this and the equal height layers or levels and thinking, the science is pretty overwhelming that 60 to 90% of the problems are lifestyle caused. Shouldn't this graphically show that 60 to 90% sort of proportionality? So we changed it. We made that foundation bigger, taking up about 3/4 of the total volume of the pyramid, again to reflect the science and make it visible, if you will. This model has stood the test of time for quite a few years. It's used in a number of leading lifestyle medicine clinics in the country. It has stood the test of time for them. We are making it available free for use for any professional nonprofit training organization, be that medical schools, other professional schools. We're going to be working on trying to make it available through signs and posters that you can order, and or as components of practice-wide licensing to use this throughout your care delivery process. An important thing we need to cover: how is this model, how is lifestyle medicine based comprehensive care, how is that different from functional medicine or complementary medicine, alternative? It's so confusing out there to so many people, both the public and professionals. What is this model? How does it fit in? This model really focuses on the science and what this should look like clinically in terms of the amount of energy and time spent on the different components of care. Really, the key difference is that 3/4 of the emphasis is on lifestyle, is on addressing causation. And causation in terms of daily lifestyle, not causation in terms of there's a second or third order thing that you need to deal with, that you need special unusual testing for, you need to take special unusual supplements for. What we find in practice is that functional medicine, integrative medicine, complementary medicine will use that second layer, those natural therapies, as really the big category. That's where they spend their time and energy. They'll give more credit to the lifestyle than conventional medicine, oftentimes, not always, but it's a different construct. It's a different set of priorities and a different set of emphasis. And of course, we always want to pay attention to evidence-based care. What does the clinical science show? What is the strong clinical pattern of the evidence of how we should go about care? So, we give to you this universal ideal model of healthcare. Lifestyle medicine is the 800-pound gorilla of any rational, sustainable healthcare system or paradigm.